Hi, my name's Erin. I'm going to be your nurse today. Can you tell me your name and date of birth?
Jane Arthur, 4556.
Great. I'm just going to check on your bracelet here. Jane Arthur, 4556. Perfect. Okay. So today I want to do some education with you. We're going to talk about injecting a little bit since you just got a new prescription for heparin that you're going to go home with. We're going to talk about prednisone as well since that's a new medication for you since you've been in the hospital, okay?
Mm-hmm.
Do you feel like you're ready to learn right now?
Yeah, I'm okay.
Okay. Some things I want to focus on for you today are the arthritis in your fingers. That might make it a little bit harder for you to open the pill bottle and also to inject the heparin, and also about how you tend to forget taking your medication, okay? Because it's really important that we remember to take our medication.
Okay.
All right. So I understand the nurse before me talked to you a little bit about heparin, about the drug itself. So what I'm going to focus on is teaching you how to actually inject the heparin.
Okay.
So the generic name is heparin, but there's a brand name called Heplock. So if you see that, just be aware it's the same thing. The doctor orders you 5,000 units, which is 1 ml, out of the vial that you'll be taking home with you. And you're going to want to inject that either in your abdomen, below your belly button, or on the tops of your thighs in the more like fatty tissue. Okay. So you're going to want to inject that on a 45 to 90 degree angle, which I'll go over with you. You're going to want to pinch a little bit of skin while you do it too, okay?
Okay.
So you're going to need, I will make sure you get all this home with you. You're going to need alcohol swabs to cleanse both the top of the heparin and your skin, and then also your needles and the heparin. So first, you're going to want to wash your hands. You should always wash your hands to prevent infection.
Okay.
And then you're going to want to roll the heparin between your hands to mix it up a little bit. Don't shake it. You should not shake it. So after you roll it, you're going to take 1 alcohol swab. And you're just going to cleanse the top of the heparin in a nice circular movement, okay?
Okay.
And then you're going to remove the cap. You'll be going home with these, like the syringes and needles put together, and also the 3 ml syringes. That way, it's a little bit easier for you to hold on to because it's a larger size and you don't have to worry about screwing the needle on.
Okay.
First, you're going to want to inject and draw 1 milliliter of air into the syringe. It's going to look like that. And I'm also giving you a picture of this to take home with you so you know what it should look like when it's drawn. So 1 milliliter.
Okay.
Don't forget. All right. So then from there, you're going to want to inject that straight into the vial of heparin. And then turn it upside down like this and go to the 1 milliliter mark again, full of heparin. Okay, just like that.
Okay.
Take it out. You're going to give it a little flick or a tap just to get any air bubbles out of it. And then you're going to take a new alcohol swab, and it might be a good idea to have it open before you start all of this. That way it's easier for you to just grab. And you'll just cleanse your skin like this. Pinch a little bit of skin, straight in, inject, and pull it back out. Now it's really important that you don't rub the skin afterwards because that can lead to localized bleeding, okay?
Okay.
And then when you're done, you're just going to put it in the sharps container.
Okay.
Which we will send home with you. We'll send home a sharps container with you as well. And when you come in for your follow-up appointments, you can bring it. We'll take the old one and we'll give you a new one.
Okay.
So some things you might see at your injection site, you might see a little red, itchy, maybe a little bleeding. That's all normal. Do you have any questions about any of that?
Yeah, what size needle am I using?
It's going to be a 5/8 of an inch to 25 gauge.
Okay, thank you.
Okay. All right, so now I'm going to give you the supplies so you can show me that you understand how to do it.
Okay. I'm going to get both my alcohol swabs ready.
Okay.
First, I'm going to wash my hands, though.
Very good. People tend to forget that step, but it's important for preventing infection.
Wash the top of the vial. Uncap my needle. Pull back to 1 milliliter. Is that right?
Yes, that's perfect.
Okay. I'm going to flip it upside down and stick it in. Oh, push the air in. And then draw back to 1 milliliter. Like the vial?
Yep, get those air bubbles out of there. And you want to not let the tip of the needle touch anything before you inject. Keep it clean.
And I'll rub the area. My belly or my thighs. I'm going to squeeze and straight down and push it in. And then put it in the sharps.
Now, are you going to rub that after you do it?
No.
Okay, very good. And then you're going to want to just rotate sites every day. Don't stick the same site over and over again because you'll get sore and bruised and that kind of stuff that you don't want. Okay. All right. So, any other questions before we move on?
No, that was all.
Okay. So next we're going to move on to the prednisone. So I'm going to teach you a little bit about that. Prednisone is the generic name for that one. Some brand names would be Deltazone or Sterapred, in case you see those. And what that's going to do for you is going to suppress your body's immune and inflammatory response, and that the hope for that is that it will reduce the pain that you're having with your rheumatoid arthritis in your hands.
Okay.
Okay. So some things you want to look out for that. Usually at low doses, prednisone doesn't have too many side effects, but you're going to be taking it for a little while, so you might want to watch out for gastric ulcers. You can take it with food. You should take it with food to help prevent the ulcers. And also Cushing syndrome, which is where you would see like fat deposits in your face and your shoulders. Your blood sugar can also rise. You'll experience muscle weakness, bone pain, and you want to report that to the doctor right away.
Okay.
Okay. So you're going to want to avoid barbiturates, phenytoin, rifampin. You're not on any of those, so that shouldn't be a problem for you. Amphotericin B and diuretics as well. Those can make your potassium drop when you take them. Okay. So that's something if you would ever need in the future to be just cautious of. Talk to your doctor about. Aloe is a herb that you can buy over the counter, and that can cause some interactions too. So try to avoid aloe. Okay.
Okay.
Some other things you should know is that your doses are going to be tapered. You're going to start on 80 milligrams for 5 days. You'll go to 60 milligrams for 4 days. Then down to 40 milligrams for 4 days, 20 milligrams for 4 days, and then you'll stay on 10 milligrams a day. So it's very important to make sure that you are checking the dose that you need, which I made you a schedule here. So your first 5 days, the next 4, the following 4, the last 4, and then from the 10 milligrams on. So that's all laid out for you like that, so you can remember. So you just want to make sure you're taking the right dose every day, and it's very important that you don't stop taking it, because you need to really taper it off, or else you can get very sick.
Okay.
Okay. Do you have any cultural preference that would affect your medication?
No.
Okay. Okay, so now again with your arthritis, I'm recommending you get a pill dispenser like this from the pharmacy. I have a picture of it here so you know what to look for.
Okay.
And it's just a button that it can pop open and your pills will be right there. That way you don't have to untwist the medicine caps.
Oh, that'd be good.
Do you have anyone who could fill that for you once a week?
Yeah, my daughter usually comes over on Sundays.
Okay, great. So then she could fill it for your whole week, and that would be much easier for you to open. And then, like I said, you have your schedule, so the different doses of medicines for each couple days. And then also I have on here to take the heparin 3 times a day, so you don't forget.
Okay.
One other method you can use to remember to take your medication is you could set an alarm throughout the day. So, for example, you'll be taking your heparin at 8 a.m., 2 p.m., and 10 p.m. So you can set an alarm for those times to remind yourself. Do you have an alarm clock or a phone you could use?
Yeah, I have a cell phone.
Okay, great. Can you show me how you would go about setting an alarm?
Mm-hmm. They made these all fancy now. I can set it to repeat on days, too.
Yes, you can.
Okay, 8 a.m. Every day.
Every day, yep.
Okay. And then, what time? 2 p.m.?
Correct.
Okay, 2 p.m. every day.
Mm-hmm.
And 10 p.m. Well, that's kind of close to my bedtime, but I'll do it. And 10 p.m. every day.
Yeah, excellent.
Okay.
Great. Do you have any other questions for me?
No, you did a good job.
Okay, well, I'm going to go ahead and send this home with you then. If you need anything else, please feel free to ask.
Okay, thank you.
You're welcome.